Let's begin by talking about what it means to scale up a program or service, and why it's important. To put it simply, scaling up means increasing the coverage of a program or service to reach more people, while ensuring systems change to sustain and support the efforts. Here's another way. Bringing a program or service to scale involves a lot more than just getting more money or providing services to more people. It also involves making sure the necessary infrastructure, systems, and cultural beliefs are in place to support lasting change. Let's explore this concept a bit more. As outlined by Professor and author Cynthia Coburn, effective scaling up involves changes to a system that address the following four interrelated dimensions: depth, spread, sustainability, and shift in ownership. So what do these concepts mean in relation to how we ensure the long-term sustainability of home-based asthma services? Let's find out. Depth refers to change that goes beyond structure and practice to transform norms and beliefs through healthcare reform. This involves creating an increased awareness of the social determinants of health and the potential for investments in preventive services to help realize improvements in both health outcomes and cost savings. For instance, the Affordable Care Act's emphasis on prevention and community health, as well as new payment models, is a good example of a transformation in norms and beliefs that can pave the way for change. Spread refers to spreading a program or service to additional sites and reaching a greater number of people. But it's also more than that. It's about ensuring that infrastructure, such as that needed in workforce, referral, and data systems, exists at all levels of the system. For example, if community health workers, or CHWs, will be providing all or part of the service, what does the CHW workforce look like in the region where you want to provide services? If you want to bring that service to scale statewide, you'll need to understand if there is an adequate CHW workforce available. And if there isn't, you'll need to know how to put one in place or find an alternative type of staff to fill that role. As all systems experience change, and the primary role of scaling up is to ensure that a program or service is long-lasting, sustainability involves embedding home-based asthma services in policy to make their delivery easy, routine, and not threatened by a changing landscape. While it may be obvious that embedding services in policies is key to sustainability, it's just as important to remember that having a policy isn't enough to ensure that a service is provided. Here's an example. It may not be helpful to build a policy around a workforce that doesn't exist, or a billing code that provides inadequate support. While you can, and should, be flexible in building a policy in order to leverage existing systems, it doesn't help to have a policy on the books if it's too difficult or impractical to use. Furthermore, it can be important to help build and maintain a support base for your policy so that if leadership changes or funding cuts occur, decision makers still understand the need for and value of the service you're providing. In Module 2, you learned that good evaluation data can help you make your pitch, but it can also help you maintain support for a program or service. Finally, to be done effectively with an existing program or service, this transformation often involves a shift in the concept of ownership from the original program or service provider to the system as a whole. For instance, if you run a local program or service, one way to think about sustainability is to get a managed care organization to pay for your services. But if a state Medicaid agency decides they want to provide a similar service statewide, they may alter certain aspects of the way the service is ordered or delivered, and the model that is used statewide may not look identical to yours. As you can see, scaling up isn't about a bigger version of a demonstration project. It's not enough to simply have more money to provide services to more people. Broader changes and supports are necessary that focus on how to put systems in place to not only deliver more services to more people, but also do it more effectively, efficiently, and sustainably. When done successfully, this means that people will have access to those needed services not just today, but also for generations to come. Visit the resources shown on your screen to review additional information on the overall concept of scaling up, and read case studies with lessons learned from other efforts to scale and sustain innovative programs.